Coronavirus cases are slowing, but the risk of severe complications looms, especially for the people who are at increased risk for severe disease, said Anthony Fauci, the chief medical advisor to the president and the director of the National Institute of Allergy and Infectious Diseases, this week at a meeting with American Association for the Advancement of Science. Read on to see the underlying conditions he presented that may put you at risk, and to ensure your health and the health of others. Don't miss these sure signs you've already had coronavirus. 1. Older adults are at increased risk. Shutterstock. Anyone can get COVID and anyone can get sick from it, but older people are at increased risk for getting severely ill. If one looks at the people who are at increased risk for severe disease, clearly older adults dominate that, because if you look at the hospitalization per 100,000 population, the extraordinary discrepancy of the age with elderly individuals, 75 years of age or older, compared to younger individuals, the discrepancy in hospitalization is profound. Dr. Fauci shared the cumulative rates of laboratory-confirmed COVID-19 associated hospitalizations by age and, per 100,000 population, 2,383 were 85 and up, 1,598 were 75 to 84, 933 were 65 to 74, and for comparison, 239 were 32. Those with cancer are at increased risk. Shutterstock. Some cancer patients might be at increased risk of serious infection in general because their immune systems can be weakened by cancer and its treatments, says the American Cancer Society. Most people who were treated for cancer in the past, especially if it was years ago, are likely to have normal immune function, but each person is. It's important that all cancer patients and survivors, whether currently in treatment or not, talk with a doctor who understands their situation and medical. 3. Those with chronic kidney disease are at increased risk. Shutterstock. People with kidney disease and other severe chronic medical conditions are at higher risk for more severe illness, says the National Kidney Foundation. People on dialysis can have weaker immune systems, making it harder to fight. However, it is important to know that kidney patients need to continue with their regularly scheduled dialysis treatments and to take necessary precautions as recommended by their. 4. Those with COPD are at increased risk. Shutterstock. Having COPD, including emphysema and chronic bronchitis, is known to increase your risk of severe illness from COVID-19, says the CDC. Keep taking your current medicines, including those with steroids in them. Steroids is another word for corticosteroids. Avoid triggers that make your symptoms worse. 5. Those with type 2 diabetes are at increased risk. Shutterstock. People with diabetes are more likely to have serious complications from COVID. In general, people with diabetes are more likely to have more severe symptoms and complications when infected with any virus, says the American Diabetes Association. Your risk of getting very sick from COVID-19 is likely to be lower if your diabetes is well managed. Having heart disease or other complications in addition to diabetes could worsen the chance of getting seriously ill from COVID-19. Like other viral infections, because more than one condition makes it harder for your body to fight. 6. Those with Down syndrome are at increased risk. I stock among groups at higher risk of dying from COVID-19, such as people with diabetes. People with Down syndrome stand out. If infected, they are 5 times more likely to be hospitalized and 10 times more likely to die than the general population, according to a large case study published in October, reports Science magazine. Other recent studies back up the high risk. 7. Those with heart conditions are at increased risk. Shutterstock.g. Heart failure, coronary artery disease, cardiomyopathies. The heart and lung work together in the body to maintain oxygenation. When the lung is affected by a respiratory illness like novel coronavirus, COVID-19, the heart may also be affected. The heart must work hard to pump blood, which may be even more difficult for someone with heart disease, says the University of Maryland. Some heart patients may have a higher risk of contracting the disease, and some may be more prone to complications in addition, the virus can cause heart muscle or vessel damage, resulting in severe problems. 8. Those in an immunocompromised state from a solid organ transplant are at increased risk. Shutterstock. Post-transplant or other high-risk patients may be at higher risk for severe disease from COVID. For severe cases, recovery may take 6 weeks or more, says the National Kidney. Because transplant recipients take immunosuppressive drugs, they have a higher risk of infection from viruses such as cold or flu. To lower the chance of getting the coronavirus that causes COVID-19, transplant patients should follow the CDC's guidance on how to avoid catching or spreading germs, and contact their healthcare professional if they develop symptoms of COVID-19. Those who are obese are at increased risk. Shutterstock. Dr. Fauci defines obesity as having a BMI greater than or equal to 30. He says those clearly stand out as important, particularly morbid obesity with a BMI of greater than 30. 10. Those who are pregnant are at increased risk. Shutterstock. Based on what we know at this time, pregnant people are at an increased risk for severe illness from COVID-19. Additionally, pregnant people with COVID-19 might be at increased risk for other adverse outcomes, such as preterm birth, delivering the baby earlier than 37 weeks, says the CDC. 11 Those with sickle cell disease are at increased risk. Shutterstock. According to the CDC, one study found people with sickle cell disease who developed coronavirus disease had high rates of hospitalization, intensive care unit admission, and death, adding, "It is especially important for people with medical conditions, such as SCD, that put them at increased risk of severe illness from COVID-19, and those who live with them, to protect themselves from getting COVID. 12 Those who smoke are at increased risk. Shutterstock. Smoke is bad for you. Now, cumulative exposure to cigarette smoke was associated with more severe outcomes among individuals testing positive for COVID-19, including higher risks of hospitalization and death, researchers found, according to MedPage. Related, Dr. Fauci just said when we'd get back to normal. 13 These medical conditions make it for increased risk, says Drive. Fauci. If you have any of the following, be extra careful. There may be a link to these conditions and severe asthma, moderate to severe, cardiovascular disease, cystic fibrosis, type 1 diabetes, hypertension, immunocompromised state from blood marrow transplant, immune deficiencies, HIV, use of corticosteroids or other immune-weakening medicines, neurologic conditions, i.e., dementia, liver disease, overweight, BMI greater than 25 but less than 30, pulmonary fibrosis, thalassemia. 14 What to do if you are at risk for severe COVID. Shutterstock. Follow Fauci's fundamentals and help end this pandemic. Use extra care if you are at severe risk. Wear a face mask, social distance, avoid large crowds, don't go indoors with people you're not sheltering with, especially in bars, practice good hand hygiene, get vaccinated when it becomes available to you, and to protect your life and the lives of others, don't visit any of these 35 places you're most likely to catch COVID.